139 of the House of Commons Standing Committee on Health. Before we begin, I'd like to ask all in-person participants to read the guidelines written on the cards on the table. These measures are in place to help prevent audio and feedback incidents and to protect the health and safety of all participants, including the interpreters. In accordance with our routine motion, I'm informing the committee that all remote participants, with the exception of Dr. Pawlowski, have completed the required connection tests. We're going to proceed with the opening statements and check in with Dr. Pawlowski at the end of that, just to try to move things along. Pursuant to the order of reference of May 29th, 2024, the committee will resume its study of Bill C-368, an act to amend the Food and Drugs Act, Natural Health Products. Just before we begin, I'd like to remind members that clause-by-clause consideration of the bill is this Thursday. The deadline to submit amendments is in 53 minutes from now. The amendment package will be circulated as soon as possible after the deadline, and I would now like to welcome our panel of witnesses. On a de Coalition québécoise pour le contrôle du tabac.
We have the Coalition québécoise pour le contrôle de tabac, Florie Toucas.
Practices Canada, Carolyn Hoffman, CEO, and Sylvia Hyland, Vice President, Operations and Privacy Officer. On behalf of the Physicians for Smoke-Free Canada, Cynthia Callard, Executive Director, and representing the Traditional Chinese Medicine Association of Canada, Pierre Chen, Registered Traditional Chinese Medicine Practitioner and Registered Acupuncturist. Mr. Chen is joining us via video conference. I'd like to welcome all of our witnesses and thank them for being with us. We're going to begin with opening statements of up to 5 minutes in length. Et on va commencer avec Coalition.
And we will start with the Quebec Coalition for Tobacco Control. Welcome to Ms. Duca. You have the floor. Thank you, Chair. Good morning to everyone. I am Florie Duca. I am co-director and spokesperson for the Quebec Coalition for Tobacco Control. The mandate of this coalition is centred on reducing smoking and nicotine addiction. We therefore do not have a position on Bill C-368 as a whole. However, if the bill were to be adopted as is, it would severely undermine current federal government efforts to protect youth from addiction to nicotine. And C-368 would actually cancel out the supplementary rules respect to nicotine replacement therapies order authorised last August under Section 30.01 of the Food and Drugs Act, which allowed the Minister of Health to impose additional rules on therapeutic products by means of a ministerial order. This authority has enabled precise and tailored regulatory rules to be established that addresses the potential harms resulting from the irresponsible promotion of nicotine-based therapeutic products that promote and glamorize and also promote their recreational use.
We're in response to the introduction to the Canadian market in October 2023 of Zonic, a nicotine pouch commercialized by Imperial Tobacco Canada that was approved for sale by Health Canada as a natural product in July 2023. The promotion of Zonic with its brazen lifestyle advertising, bright colors and exotic flavors such as tropical breeze and berry frost clearly evoked themes like pleasure, lifestyle, and youth. Images of young people in social settings populated these promotions, clearly painting aspirational lifestyles for youth. Since the ministerial order issued last August, these NRTs remain available for smokers across the country. But across all provinces, they must be sold by a pharmacist, kept behind the counter, cannot be sold with flavors other than mint and menthol, cannot be advertised in a way that is appealing to youth, require a warning on addiction, and cannot come in packaging that has youth appeal. By amending the definition of therapeutic products in the Food and Drugs Act to exclude natural health products, Bill C-368 would eliminate the effect of these new regulations. The lack of federal measures would also serve to undermine stricter provincial regulations, such as those that exist in Quebec and BC, by creating enforcement challenges resulting from online interprovincial sales and promotion. Should Bill C-368 be adopted without an amendment to carve out NRTs from its scope, Health Canada's current ability to enact mandatory recalls of NRT products when deemed necessary to prevent against injury would be eliminated. Health Canada would be prevented from vetting promotional materials before new products hit the market. Industry could roll out new NRTs with all kinds of flavors that can be enticing to youth. The effects of adopting an unamended C-368 would be felt beyond Zonic pouches. There is actually a global corporate campaign to reframe nicotine as a more benign and ordinary consumer product akin to caffeine, with beneficial effects such as helping adults to relax, as Imperial Tobacco states on its website. Tobacco industry documents reveal that the introduction of novel nicotine products aim to compensate the decreasing smoking rates around the globe by creating addicts to new nicotine products. We've seen this with vaping. For this reason, the Quebec Coalition, without endorsing either the adoption or the rejection of the proposed legislation, respectfully asks that, should Bill 368 go forward, the Standing Committee on Health amend it to carve out nicotine products from its scope as provided by the legislative text found on the first page of our written submission. Nicotine is a drug that causes harm, not only through addiction, but also in terms of physical and mental health, especially among youth. In a January 2024 policy brief, the World Heart Federation wrote, and I quote, "For decades, the tobacco industry has promoted the myth that nicotine is as harmless as caffeine. Nonetheless, evidence shows that nicotine is far from innocuous, even on its own. In fact, numerous studies have demonstrated that nicotine can harm multiple organs, including respiratory and cardiovascular systems." End of quote. Meanwhile, numerous other scientific publications have confirmed how, because their brain is still maturing, nicotine exposure during adolescence alters cognitive function and attention performance in youth. Si C-368 allait de l'avant,
should Bill 368 go forward, it should be amended so as to carve out all nicotine products from its scope. Thank you very much to you, Ms. Ducat.
Institute for Safe Medication Practices of Canada, 5 minutes in total. Ms. Hoffman, are you okay? You have the floor. Welcome.
Thank you, Chair. On behalf of the Institute for Safe Medication Practices Canada, we appreciate the opportunity to provide our perspective regarding Bill C-368. ISMP Canada is a pan-Canadian, not-for-profit and independent organization established in 2000 to improve the safety of drugs and health products for Canadians. Our key activities include expert analysis of error reports from consumers, providers, and healthcare organizations to learn about the risks related to these products, to share evidence-informed recommendations for improved safety, and to work with consumers, care providers, and other health system partners to reduce preventable harm. We recognize that access to safe, natural health products is important to Canadians. Through our work and that of others, we know that the manufacturing of NHPs and the use of NHP products are not without risk. Many Canadians may not be aware that NHPs are a broad category and include more than vitamins, herbal remedies, traditional medicines, and homeopathic medicines. For example, acceptable medicinal ingredients also include scopolamine, pseudoephedrine, and methyl salicylate. Consumers have shared with us that they believe that Health Canada has rigorously checked and approved all NHPs for their safety. They also assume retailers will only sell them if approved by Health Canada and they are safe for sale. To quote consumers directly, "I trust what is on the shelf is good for you and that they are safe since they are on the shelf." Over 700 incident reports related to NHPs have been reported to us, including 400 since 2019. Of these 400 reports, over 15% indicated some level of harm. Most were mild harm, however, 2 were reported as contributing to a death. Importantly, there is underreporting of incidents to us. We have 2 key areas of concern regarding Bill C-368. The first is that natural health products will be exempted from the important regulatory provisions under Vanessa's law. We provide 4 specific examples of the impact. Health Canada would no longer have the authority to recall a product from retail settings if there is an identified serious risk. Health Canada would no longer have the authority to compel a label change if there is an identified serious risk. Health Canada would no longer be able to advance new regulations that will require license holders to conduct additional tests to help inform Health Canada's risk assessments. And Health Canada would no longer be able to advance new regulations to require that serious NHP adverse reactions be reported when a patient is seen in hospital. Reversing this capability is concerning because this information is essential to better understand the magnitude and impact of the risks related to NHPs.
The second key concern regarding Bill C-368 is the negative impact on the precision regulatory powers that are in place to address serious risks related to NHPs. These powers also depend on NHPs being defined as therapeutic products in the Food and Drugs Act. An example is, as we heard just now, the recent ministerial order for requirements regarding the sale of nicotine pouches and the risk to kids. The order requires that nicotine pouches be kept behind the counter in a pharmacy and not sold in convenience stores. To provide another example, serious risks related to pseudoephedrine were addressed by the May 2024 interim ministerial order. However, it will expire. To be clear, these are only examples where the ministerial order may be required to address emerging risks related to NHPs, emerging serious risks. Precision regulatory powers are needed when risks arise after a product has been approved to be marketed for an intended purpose and the product is being used in ways other than was intended and approved. We can anticipate that other serious risks related to NHPs will arise in the future. Health Canada must have the authorities to conduct the post-market regulatory activities that will identify serious risks with NHPs and be able to take timely action to address these risks when needed in urgent situations. In conclusion, the Vanessa's Law authorities and the precision regulatory authorities powers that we have highlighted today should remain in place. Bill C-368 would reverse regulatory changes that are needed to protect the health and safety of Canadians. Thank you.
Thank you. And next we're going to go to Physicians for Smoke-Free Canada. Ms. Callard, welcome to the committee. You have the floor.
Thank you very much for the invitation to appear. For those of you who are not familiar with us, our organization is a small health charity with a 39-year history of providing information and advice on tobacco policy. Our members are all physicians, but I'm not. My comments today are based on a policy analysis, not on the clinical use or on the overall implications of this bill for the NHP category. For those more general perspectives, I refer you to the brief submitted by the Canadian Medical Association. I just want to say that Bill C-368 has implications for tobacco control that go beyond the Zonic or nicotine pouch issue. That's because most stop-smoking medications are licensed as natural health products. There are 2 categories of drugs, bupropion and varenicline, that are prescription-only drugs that are licensed as under the drug product regime. But there's about 100 authorizations for stop-smoking medications under NHPs. These include, the largest category are nicotine replacement products. This can be gums or patches or now pouches or inhalers, or there's a large category and more on the horizon, like nicotine pearls. Another category is cytazine, which is a drug that's derived from laburnum trees, which has proven efficacy and is a new drug in Canada. with largely, I think, unknown impact in terms of its overall use. And then there's, of course, homeopathic and herbal medicines that are licensed, even though they have no real, they're not considered these days to be a particularly effective treatment. But one thing that's important to consider is how the NHP smoking cessation market is changing. There are new products and new players, and these are posing new regulatory challenges. Stop smoking medications are no longer manufactured and sold by consumer health companies. They're sold by tobacco companies and nicotine companies and even cannabis companies. Zonic is the most recent entry, but it's certainly not the only one. This package of Sesh nicotine gum I picked up at a Circle K last week. It was sitting on the counter right beside Reese's
Point of
peanut
order,
butter.
Chair.
Sorry?
From Dr. Ellis.
I apologize for interrupting the witness, but I think we've made it clear in this committee before that we don't use props, and
I
I would
apologize.
ask the
I apologize.
witness not to do that. Thank you.
I will just tell you that I did purchase. There are other products on the market that are sold in convenience stores beside the candy counter. They don't look like a pill. They don't look like a treatment. They look like something interesting. The other products are on the market, the gums, do not seem to be a problem, and we have not called for new regulations to be placed on them or precision regulations, but we need the power to intervene if they were. If children were experimenting with these, if these became an on-road to nicotine addiction instead of being used as a way that just maybe people were just, using them in the bar or something instead of smoke. If there were reason to have concern about them, we would like the government to have the authority to come in. In the U.S., the same product is made by the same company, is sold with the disclaimer that this is not an FDA-approved smoking cessation aid, and it's not intended to be used to quit smoking. But in Canada, the same product is sold as a smoking cessation aid. In the United States, it's sold as a way to enhance focus, boost your energy, or relax. Other tobacco companies which are licensed to sell NHP nicotine in Canada include Swisher Cigars and Philip Morris International subsidiary. Turning Point Branch is a cannabis-focused company that has a license also to sell NHP nicotine in Canada. The ingredients of a drug product, are only part of the risk. From a clinical perspective, nicotine replacement is a well-established treatment for tobacco addiction. It seems to make not much difference how that nicotine is delivered to the body. But from a public health perspective, it makes a world of difference of how the product is delivered to the market. The business model of those who make it and distribute it, how it's advertised, who sees the advertisements, whether influencers are promoting it, etc. Those are the aspects that make the product risky. And the supplementary rules that were adopted for Zonic are mostly about marketing. They're not about the product itself. So one of the reasons that these supplementary rules took months to prepare is because new legislative powers were required. These powers were part of the spring's budget. Bill C-368 would take those legislative powers away, not only for Zonic, but for all the other smoking cessation products manufactured by tobacco companies or others, for whom the clinical benefits risk being overshadowed by the overall health risks to Canadians. The Food and Drug Act was not designed to manage tobacco companies. Last week, I heard other witnesses being asked about consultation on the authorization. There's no consultation with any outside group when the department decides on whether to authorize an NHP. As I understand it, each application is confidentially reviewed against established clinical criteria, not public health criteria, and it's decided on without input from other stakeholders or any public health impact analysis. Canada is lacking an overall nicotine regulatory framework. The regulation and management of tobacco products and vaping products is in one branch of the department under one law and under a different minister than is the NHP nicotine. This is a problem. I think it would be wonderful if the committee could suggest to Health Canada that they start working on an integrated nicotine framework. The precision regulation was a bit of a Band-Aid solution, but it's a Band-Aid solution that we urgently needed. It's a Band-Aid solution that we continue to need. And until there's a more permanent solution in place, we implore you to not remove that and put Canadian children at additional risk. Thank you.
Thank you, Ms. Callard. And finally, the Traditional Chinese Medical Association of Canada, Mr. Chen, welcome to the committee. You have the floor.
Hi, thank you so much for having me. Today we're talking about Bill 368. I am a importer of Chinese medicine. I'm also founder of Canadian College of Traditional Chinese Medicine. I have a master's in Chinese Western Integrative Medicine. I'm also a Harvard medical educator. In nonprofit, I set the standard in Standard Council of Canada for TC 215 and 249 for Chinese medicine. So what we're looking at today is a regulatory change, a regulatory mismatch for natural health products, putting it into a drug model, into Vanessa's law, treating food items and herb items as pharmaceutical items, which is not. So if you have the package that I sent out, food safety in Chinese medicine, if you go see a Chinese medicine practitioner, if you have kidney problems, they might prescribe you kelp or seaweed. If you have lung problems, they'll prescribe cinnamon, gingers, onions, etc. These are the natural health products that we are using. In Ontario, there are 2,700 Chinese medicine practitioners and acupuncturists. Quebec, there's about 1,000. BC, 2,000. If you move down in the slides, out of these practitioners, Ontario, 65% are female. Direct job impact. In Job Bank Canada, 2021, the record shows that there's 66,000 natural health Chinese medicine and acupuncturist natural practitioners in Canada. Indirect job impact in Canada, we have herbal farmers. So there are over 2,000 individuals that are under the Good Agricultural Collection Practices. In Saskatchewan alone, 30,000 acres. Ontario, there's about 150 ginseng growers. We are the purchasers and we are the users of these natural health products. So all these farmers would be out of business if we don't support these farmers as well. So we need something tailored, designed for natural health products. And right now, what we had worked. And it's going to affect us greatly if we don't pass Bill 368. Our patients, out of the 60,000 practitioners, most of our patients are women, seniors, and minorities. All these patients, most of us have hundreds, if not thousands of patients. All these patients would be affected without the access to natural health product. So if you move down, there's the proposed fee, amended fee. So these are some of the companies that we're looking at. So most of these companies annual renew. It's very common for us to have around 1,000 licenses. We don't use all the licenses simultaneously, but some, if we need it, we need the license to have access to the herbs. To upkeep, you're looking at $130,000 to $200,000 annually just to keep the license, not including the application fee, which is another $100,000 to $200,000 to apply. This means that most households, especially people with lower income household, would not have access. It would push us as importers into black market. So to avoid the 100, 200,000, what people would do is they would sell online. They would not apply. So that means these food items, we want to have health claim. We're trying to do the right thing. What we're going to be forced to do is just sell it as food items, and we're just going to say it has no effect. And all these practitioners could not have health claims on these items that they're prescribing. This on the next slide, you'll see an example of Jiawei Xiaoyao one. It's a pretty standard formula. Right now on the market in Canada is about $9, $10. With the proposed fee, we're looking at close to $50 to $100 increase per product because a lot of these licenses we don't use. To keep those licenses, we're going to look at $50 plus the $10. So it would make it hard for people to purchase and use these products. So the purpose of natural health product is for food items, for herbs that we're prescribing as practitioners to have a health claim. It's not an escape for drug items to escape their responsibility as a drug. So I see previous experts talking about nicotine. I totally agree with them. Nicotine is highly addictive. And in a lot of countries, Australia, Japan, Thailand, they are considered drugs. And they have a separate regulations like the Tobacco Act of Canada that we use them to protect our public. But it's not natural health product. It's not an escape for them to avoid the necessary law. So current issue with the Chinese medicine, we'd also talk about evidence-based medicine. We want to have evidence-based in natural medicine too. We want, we hope we have grants, research fundings, which we don't have. But adding this additional law, Vanessa's law, to this would only push us to the black market, would push us onto the other side of border. We're going to have to sell from the U.S. where, these $10,000, $100,000 regulation fees are not realistic, and we're going to have to sell from other countries to Canada where people can have access from illegal markets and avoiding these costs. Thank you so much.
Thank you, Mr. Chen. We're now going to proceed with rounds of questions, beginning with the Conservatives for 6 minutes. Dr. Ellis, please.
Thanks very much, Chair, and thanks to the witnesses being here. I once again find it interesting that many witnesses have come here to talk to about a single issue, at the expense of a $13 billion Canadian industry. Ms. Dukas, you talked about nicotine, of course, and I don't think you mentioned anything about natural health products, again, which is a $13 billion industry. I think we've heard from many other witnesses, and I think everybody around this table agrees that nicotine is dangerous. That being said, would it not make sense to create another framework to deal with nicotine products? I think some of the other witnesses explained that as well.
Thank you for that question. Thank you. Sure, it would be great if we had a framework, but we don't. And we just can't afford to wait for a framework. Nicotine is highly addictive, and that's what the ministerial order tried to tackle in a prompt way. So I think that the idea here is just to, should Bill 368 go ahead, to carve out nicotine products.
Thanks very much, and through you, Chair. So what you're telling me is that this federal Liberal government is suggesting that it's too difficult to deal with nicotine products, so we should destroy a $13 billion industry to do it, that they don't have any idea, no clue of how to create a new framework. Is that what you're suggesting? Have you had those discussions with them?
Dr. Ellis, we've suggested an amendment that's part of our brief on page 1, and I think that...
No, I get that. I asked you a very specific question, though. Have you talked about another nicotine framework with the federal Liberal government?
I think we've been dealing with it. Thank you for that question. We've been dealing with an industry that has outpaced regulation. It's happened all over the world, and governments are struggling to keep up with the new products that are being put on the market.
Thanks very much. I guess I'm going to struggle with your answer in the sense that is what the House of Commons does. It creates laws and regulations. And obviously, if we have a government that refuses or doesn't know how to do that, that creates a problem for Canadians. But what I'm saying to you is, great, an amendment, super. I just find it difficult that we have a government that doesn't have any other way to do this besides having folks like yourselves come here with a single agenda to talk about something that is a tiny part of a $13 billion industry. I think that's, for Canadians, and especially for Canadians who use natural health products, that's distressing, very distressing. But thank you for that anyway. Ms. Hoffman, I'll move on to you through you, Chair. You talk about 700 incidents of reports, or I can't remember your exact wording, of difficulties with natural health products. Can you tell me where you found that information?
Thank you very much for the question. ISMP Canada directly receives reports from consumers, individual practitioners, and healthcare organizations. Within that, it crosses all the continuum of possible products. We looked into our database, and we had a total of 700, 400 of those since 2019. Now, these are errors or issues. These are consumers saying, the label was confusing, I bought the wrong thing, and then I was out the money and I didn't get what I needed. Right up to, this is an incident report where an NHP was overused and contributed to, for sure, in the cases that we talked about, the death of someone.
Great,
And so we
thanks for
take
that.
those in and analyze them.
You know, can you tell us how many reports you had that there were rodent droppings and urine in the products?
I don't have that level of detail about each and every report. We have a summary for you today.
And could you table the entire report with this committee as well?
We could undertake to compile and provide a report.
Yeah, you made it seem like though you have these 700 different incidents of problems with natural health products, as you mentioned, from something as somebody read the label wrong or had a mistake to your egregious claim of death. But that being said, I would like to see all 700 of those reports. This is a very serious issue. We have a government who has said previously that hundreds of people have died by the hands of these products. They were never able to provide that information. That is why I'm telling you on behalf of Canadians to provide those details of these 700 reports, because that's very, very important information. Will you do that?
Thank you very much, Dr. Ellis. And I should say that we regularly update and issue bulletins and newsletters on
I'm
this
sorry, I'm
topic.
going to interrupt you because I didn't ask you about that. I want you to provide those reports. This is a very, very serious issue. Will your group, who's made these claims, provide those reports to this committee? Yes or no? It's a simple answer.
Thank you, Dr. Ellis. We do have a commitment and requirement around privacy of personal information. So
I'm
the
sorry,
specific
Ms.
copy-
Hoffman, I'm going to interrupt you once again. You've made a very serious claim against a $13 billion, often women-led industry on behalf of Canadians who we have received more information on this than, and more complaints about this egregious overreach than in any other situation. I'm asking you one more time, will you provide these 700 incidents, or is that not a true statement?
Thanks, Dr. Ellis. To be factual, we have received 700 reports. I'm going to have my colleague, our privacy officer, just speak to the legislative requirements that we live and work under.
I'm sorry,
And that
Chair, but I mean,
makes
this
it
is
very
ridiculous.
important
People
for
making
to trust
ridiculous
us.
claims and unable to provide evidence of them. This is unacceptable in front of a committee, Chair.
We're also out of time. So if Ms. Hyland is going to be able to speak to this, it'll be at the request of one of the other members. We're going to go now to Mr. Nakvi, please, for 6 minutes.
Thank you very much, Chair, and I want to thank the witnesses for being present today. Before I ask them questions, I would like to move a motion, Chair, and the motion was submitted to the committee on Friday in both official languages, and it reads that upon the tabling of the supplementary estimates B for the fiscal year 2024-25, the committee invite the Minister of Health and the Minister of Mental Health and Addictions to testify on the supplementary estimates B at the first meeting following the passage of this motion.
Un appel à règlement,
Wait.
Point of order, Mr. Thériault. Now, as I've always done, I've always objected and denounced this practice from my Conservative colleagues. And so I do not believe that Mr. Nakvi should actually drop that motion at this moment in our meeting. We have serious questions to put to our witnesses. And by doing what he's just done, that could open up a whole conversation which would lead us completely away from listening to the witnesses. And Chair, I had asked for adjournment of that motion. You cannot propose a motion on as part of a point of order. This motion was correctly submitted. I do accept your criticisms. However, point of order, another point of order.
Julian, please.
Thank you very much, Chair. I very much agree with what Mr. Thériault has just raised. We have witnesses before us. We're working on a draft bill which is important, which has a significant impact, and it also has certain gaps that need to be overcome. So I'd really ask that this motion should be withdrawn for the moment. We have 2 hours. We can come back to this at the end of our meeting, but I'm concerned that otherwise we won't have time to put our questions to the witnesses. if this motion is submitted at this particular time. You have proposed exactly what was put forward by Mr. Thériault. My decision has not changed. It is not appropriate to propose a motion as part of a point of order. This motion is before the committee, and we'll start with that, therefore.
Okay. Est-ce qu'il y a un problème avec la
So if you press
traduction?
where it says French,
Yeah, I did that.
it won't come up?
No, yeah.
Have you entered the,
Language, English.
I'm testing the English channel from French to English. Can you hear me in the room?
Yeah. Yeah, maybe.
perhaps we can get our French colleagues to say something and you can see if that's.
Est-ce que ça marche?
Is this working if I speak in French? Is the translation coming through?
Monsieur,
Well, I would suggest to Mr. Julian and Mr. Thériault to put up their hand to speak on the motion, and when you have the floor, you can put forward a motion for adjournment. But for now, before you, I've Ms. Sidhu and also Ms. Goodrich on my list. So first of all, Madam Sidhu.
Mr. Chair, I want to put the amendment on Mr. Naqvi's motion, if you allow me to read. And the committee invites witnesses, including but not limited to Kids Helpline, Brain Canada Foundation, and U15 Canada, to testify on the supplement estimates, Section B, by no later than the end of the current supply period.
has the amendment been circulated? Okay.
Point d'ordre, Monsieur le Président.
Oui.
Point of order, Chair. The interpreters do not have the text of the motion, and that is posing a problem. So could you please provide them with the appropriate text?
Okay, merci, Mr. Thériault.
Thank you very much, Mr. Thériault.
Yeah, okay. Okay, on va en train de le régler.
Yes, we're trying to sort that out, resolve that issue.
So for the amendment, okay, are we able to circulate the amendment for everyone?
We need to get the test.
Okay. 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 Ms. Sidhu, if you could have the amendment circulated. Ms. Goodrich is next on the list on the amendment. Are you ready to speak to the amendment, Ms. Goodrich?
Yes, thank you, Mr. Chair. I think it's rather frustrating that here we have witnesses that have made their time to come here to this committee. We're having this conversation on important legislation, as my colleague has stated. This is $13.5 billion industry that the health minister is looking to completely change the rules of the game because he made a mistake and allowed a nicotine pouch to be approved. That was a decision Health Canada made. He has other tools in his toolbox that he could be dealing with this, but instead he's deciding to destroy an entire $13.5 billion industry. But they also know that they have made mistakes, and so instead of actually having these conversations and being able to ask witnesses questions, they're deciding to interrupt in the very first round of questions to these witnesses, which I think is absolutely disrespectful and something that is better than them. We have endeavored to put motions forward at the very end of a meeting rather than the very beginning of a meeting to prevent time being wasted. So with that, I will move to adjourn debate.
A motion to adjourn debate is not itself debatable, so we're going to go straight to a vote on a motion to adjourn debate. Are we okay to do it by show of hands? Do you want a recorded division? All those in favor that the debate now be adjourned, please raise your hand. All those opposed. The debate on the motion is adjourned. And we are back to rounds of questions. with Dr. Hanley, please. You have just under 6 minutes.
Okay. Sorry, caught me by surprise there. But I do have lots of questions. I first want to thank all of the witnesses for attending and for your testimony. And I think, Ms. Kellard, I'd like to start with you on your recommendation, which I don't think we can enter, but take note of, although it's not specifically related to this bill, but you said that Canada lacks a tobacco regulatory framework, and I wondered if you could briefly expand on how you would see that as helping advance really the multiple causes that you've described on nicotine and dispersal of nicotine.
Thank you. In fact, I worked in Parliament in 1985 when we passed the first Tobacco Products Control Act. And that was amended, was passed again in 1997 after being defeated. And then it was amended in 2018 to be the Tobacco and Vaping Products Act. And that change reflected the fact that all of a sudden vaping products were sold at that time illegally, for a long time illegally, but it legalized an essentially gray market. But tobacco companies continue to evolve the products that they do. As my friend Flory pointed out, smoking rates have fallen. In 1985, when the first law was passed, half of Canadians smoked cigarettes. Now we've made a lot of progress. It's down at about 12 or 13%. We've really made progress. But tobacco companies have found that they no longer could get kids to smoke cigarettes, so they've looked for other products. And it's just taken a long time to get laws to kind of reflect what the market really looks like. So in 2018, well, let's put it this way. We started seeing vaping products on the market around 2009. It wasn't until 2018, and after this committee had hearings on it and then a long delay and a few ministers and a few governments and, different stripes of governments. But it took like 9 years before we got a law that way. Those of us who've been in this game for a while know that it takes a long time to get new laws in place. And we're not talking about 1 year or 2 years. It takes a lot longer than that. And so, as my friend pointed out, governments have just not been able to catch up to the industry. So we really need a deep think about what we're going to do, what types of nicotine we tolerate the use of, what types we encourage the use of, what types we discourage the use of, and what types we forbid. That's a difficult question.
Thank you.
I'm sorry to take up some of your time.
Yeah,
Sorry.
I know I have only limited time, so I'll interrupt you.
Sorry.
But this is to Ms. Hoffman or Ms. Hyland. But thank you for your testimony. I was curious about you mentioned about the reliability of the data that you do have, and that I'm just wondering if there could potentially be underreporting of adverse effects because we don't really have a reliable data collection system. Could you comment on that?
Yes, I'll briefly start and ask my colleague to jump in. Our position is that there is significant underreporting. Many consumers, providers, healthcare organizations do not know the reporting mechanisms to report and share this information. Anything to add?
Yes, definitely. And I'll add that Vanessa's law is an excellent law. A lot of work was done to bring that law into place in Canada. And we believe that NHPs should be under Vanessa's law. We believe that reporting and identifying serious harms with natural health products is important, and without that, we do not know the harms that are occurring. And if we knew more, we would be able to inform consumers better, empower them better with warnings about the products they are buying so that they are aware and can make choices as an informed, empowered consumer.
So better data collection, enactment of Vanessa's law, would relate to actually consumer confidence, because you mentioned about that. If you see something on the shelf, you assume that it's that it's safe. So this would actually reinforce what the perception of the consumer actually is.
Absolutely.
And therefore, should be beneficial for businesses.
Absolutely beneficial for business, especially made in Canada business.
Thank you. Do I still have time, Mr. Chair?
1 minute.
Okay, perfect. Madame Ducasse, merci pour votre témoignage.
Thank you for your testimony.
There was a line where you said you referred to undermining stricter provincial regulations. Presumably you were referring to Quebec, perhaps elsewhere, but I wonder if you could briefly elaborate on that.
Thank you for that question. Merci. Yes, so Quebec has only allowed sales of NRTs in pharmacies for the past 20 years. Initially, it was the only province to do so. They were not behind the counter. They're just in main space under the supervision of a pharmacist. And at this point, the Order of Pharmacists felt that that wasn't enough. They saw that the Zonic products were being bought up by young people walking into their store. It's not illegal to sell NRTs to minors, but there was no interaction between the pharmacist and the youth. So the Order of Pharmacists has asked its members to place the products behind the counter. The ministerial order followed suit and has expanded that to all of Canada. BC did the same before the ministerial order. Should we have this patchwork of regulations or protocols? Because in Quebec, it's not a regulation; it's the Order of Pharmacists that have dictated that. We would see that being undermined with provinces that, let's say, would still allow, should the ministerial order fall.
Thank you.
Products could be sold online in convenience stores. They could be shipped to uncompliant, to places where those products would be uncompliant.
Thank you. Suite, Monsieur Thériault, pour 6 minutes.
Mr. Thériault, which natural health products are you referring to? We're talking about nicotine and patches. Yes, it's important to specify that because, as you know, we're going to bring an amendment to C368, and I thought I'd understood that you had not explored the whole of the issue around the intention behind this bill, but that you were saying today that the bill as drafted has a perverse effect, namely countering the ministerial order which allowed us to have a better control on nicotine-based products. Have I correctly understood you? Yes, that is correct is the answer. Now, if we do consider that nicotine is a hard drug in terms of addiction, is that an exaggeration to state that? No, it's not an exaggeration when it comes to current practice. So if we know that nicotine from an addictive point of view creates a high level of addiction and that the alternative products to tobacco, which are accessible to youth amongst other people, then creates other addictions that are strong as or stronger than the addiction they'd have had if they decided to smoke. If we remove this bill, would you actually believe that would be an acceptable step? Well, I just want to be certain that I've correctly understood. We're talking about exempting nicotine products from the scope of 368. Yes, exactly. So the nicotine-based products would be placed again under Vanessa's law and allow for that to be regulated according to as proposed in the ministerial order. Well, insofar as we have the ministerial order measures, that's what we want to actually protect and retain. Now, earlier, we talked about something. I am happy to hear your viewpoints. It's important to hear these. Earlier, we referred to the fact that there would need to be a serious discussion about this 13 billion industry, and the global tobacco industry represents 694 billion in 2019, and that didn't stop us coming up with rules and setting frameworks around this industry. But it took a great deal of energy and various procedures to achieve that. When it comes to natural health products, in the broad sense of the word, we've understood that the industry itself did not want to play with bad actors. This industry wanted to maintain its reputation. So if we were to bring an amendment or two other amendments, in fact, which would allow the minister to have his right to recall within the context as we see in 368, so within a completely different legislative context from the one that applies to pharmaceutical products, such as was allowed for under the NHP regulation. But we would give the minister and grant him this power to recall and ensure that the fines were at appropriate level, because the NHP industry, it's not made up of multinationals that have got 20-year patents, and it's not multinationals where their products are not taxed, etc. We're not talking about the same type of industry makeup at all. However, we have to ensure that these products are not risky or dangerous for the population, so there need to be a right of recall for the minister and appropriate fines set depending on the legislative framework that we define. That way we wouldn't harm the industry, but we would have a stricter framework applied to this industry in question. Because if we're here today, and this hasn't been said so far, we refer back to 2018, but it's because the health department has not done its job. This industry is already regulated. The recall is already there on a voluntary basis. We could allow for a right of recall for a minister, but a right of recall from the minister, that doesn't actually replace the obligations of Health Canada to carry out the correct inspections and carry out the correct checks. And that has not been done vis-a-vis this industry for a long time now. So we shouldn't mix everything up here and think that if we cover ourselves with a bill, with a magic wand, we're going to be able to protect the population. Health Canada has its obligations, its duty to educate. When we talk about interactions, it will be the duty of Health Canada to talk about these interactions, because there are interactions between natural health products and pharmaceutical products, and between the natural health products themselves. So, ladies, it's relevant what you're saying. We've heard from you, and we will propose amendments to this bill so that these adverse effects or perverse effects can be lessened, and so that we can have a bill which ensures that we can bring together, marry the interests of everyone, so that consumers' interests at the end of the day are preserved. We want to have products that are available, but we want to ensure that they are safe products that we buy. Thank you very much, Mr. Thériault. And now, Mr. Julian, for 6 minutes, please.
Merci beaucoup.
Thank you very much, Chair, and thank you to our witnesses. We've adopted this bill in the House and then brought it before the study, and we want to always try and improve bills. And this is a bill that has certain gaps, undoubtedly, but it is also an important bill dealing with natural health products. And we know very well that it is essential that we continue to give accessibility to these NHPs, and it's also important for this industry to be able to continue to prosper. All of these points are important, but we have to also address the gaps, and you've all identified issues, in particular when it comes to nicotine-based products. That's something that has to be borne in mind, and Mr. Thériault has just raised the fact that we are looking into amendments to improve this bill. Now, Mr. Duca, or Madame Duca, I'd like to come back to 2 points that you made in your opening remarks. And in passing, thank you very much for being here today. You've talked about the approval of Zonic in July 2023. And I'd like to know if there was any consultations held before approving that Zonic product. And then a second point that you've raised is that the tobacco industry will often say there's no problem with nicotine. Could you briefly touch on all of the negative impacts that nicotine actually has on our health? Thank you very much for those questions. When it comes to the authorization that was granted by Health Canada, no, as my colleague has said, the process takes place behind closed doors. The groups are not consulted. Companies always want to avoid competition or warn about competition. So all this is data-based rather than a clinical and public health basis. And we are talking about health issues that go beyond clinical trials. We don't want to demonize nicotine products, but it's a question to whom we're addressing this and how are we promoting these products. And that's where we need to avoid these adverse effects occurring. So that was the first aspect. Then secondly, there are very few studies, in fact, on Zonic pouches. It's a product that's relatively new in Canada and other markets as well. It existed in the US a few years before it turned up here in Canada. But nevertheless, it's a product where we don't have lots of studies yet because it is something that's relatively new. That was the first point. Then on the effects, there are multiple risks. For nicotine, for a long time, it's difficult to distinguish from the effects of tobacco and smoking and separate these from the effects that are only related to nicotine. But now with these new product variations, we're able to see in studies that there are more specific points. I know you've heard from the Heart Disease Foundation. It clearly increases this type of risk for all of these precursors for cholesterol and all of the cardiovascular illnesses. And we're starting also to have concerns about damage to organs such as our liver, amongst others. Science is evolving in this area. Thank you very much. So I've got other questions to put.
I am looking through as we look to improve the bill, and we want to ensure natural health products continue to do the good work that they do across the country. We have an industry that is virtually 100% compliant, and I'm just looking at your figures and the figures that were presented by the Minister of Health when he came before this committee, which are very similar, 350 voluntary recalls. The government has talked about, you've talked about 400 incidences in 2019. I believe the definition that you're using is a little looser. But the Minister of Health talked about the fact that in virtually every one of those voluntary recalls, except 3 cases, there was compliance by the companies. And those 3 cases where the companies were non-compliant, those companies no longer exist. What do you think of the argument that has been put to us that I find very valid, that there are a wide variety of tools that can be used now by the government to ensure that companies are compliant and that they conform with voluntary recalls when there is risk?
Thank you for the question. Important to clarify initially, clearly, the data that the minister presented is separate data than I just presented. So 2 different data streams. There will be some interrelationships, but 2 different data streams. Then, the discussion about, any changes and possibly any detail around the 3 cases that the minister spoke to. We're not in a position to speak to those details. We were not privy to the specific details around those cases. I'll just check with my colleague. Anything else to add?
And just your question, I just want to get clarity on your question again.
The question is,
what do we think about the tools and authorities that
they already
has now?
The government has now, and the Minister of Health, I believe, admitted to that. 350 voluntary recalls, only 3 companies non-compliant.
So I think that right now, Health Canada's positioned to have authorities and tools through Vanessa's law. They've designed it carefully and made a decision that it works well, it's very good, and NHP should fall under it. By doing that, Health Canada could compel a label change to add a warning to inform the consumer. By doing that, Health Canada could, with consultation, as they always do, develop regulations for reporting of serious adverse reactions by hospitals. So those are the things that they have now, and this bill is going to remove.
No, I think we're talking cross purposes. These are voluntary recalls.
Thank you.
The legislation was not needed in almost all of these.
So the legislation is needed when a voluntary recall doesn't work.
That's your time. Ms. Goodridge, please, for 5 minutes.
Thank you, Mr. Chair. and I'd like to thank all our witnesses for being here. So, Ms. Hoffman, I just want to kind of follow up a little bit. So you used the number 700, and now when my colleague was asking questions in regards to being able to allow us to see this documentation, you kind of skirted around the issue saying, well, you couldn't give us an exact list. Well, the number 700 clearly comes from somewhere. And I understand privacy. Each and every one of us are bound by freedom of information in our offices and are used to dealing with sensitive information on a regular basis. And parliamentary privilege does give us some immunity and some space to actually ask witnesses to provide us with this information. And depending on the sensitivity of the information that is given to us, there are a variety of different checks and balances that go into determining how that information can therefore be used. But if you're coming in here giving a specific number, 700, and we ask you for that number, we expect you to be able to show your work. So are you telling us that you can't show your work?
Thank you for the opportunity. We can definitely show our work. I'd like our privacy officer to speak to what we can provide.
Thank you. It's a nuance here. Can we show our work? Yes. Can we table a report to this committee? With pleasure. Will it be, as was originally suggested, each and every report copy just handed over? No, it will. You
That's
said
not.
a list.
I just want to be. No. We at no point did we say hand over every single documentation from everything. Frankly, we've got a pretty busy course load and a pretty busy amount of stuff. But I want to see the list of 700 so we can determine, is this people reading a label wrong or is this people actually getting hurt? Because a number of 700 in a country that's as large as Canada, we need to see how severe are these, period.
Okay. So thank you for that. We heard something different. A list is possible in terms of de-identified information, which products involved, and how those, what information we might have on how.
Thank you. So can you please provide that to the committee, ideally before Thursday, because we do have to go into clause by clause, and having that information will be helpful to make sure that we are dealing with the right information before we head into doing clause by clause and are doing amendments, which the deadline for amendments is by the end of this meeting, but this will be helpful, so the sooner the better. But to go on to the next piece, Dr. Chen, I really appreciate you coming here today, or Mr. Chen, sorry. How many practitioners are in your industry here in Canada?
I have in my report Ontario about 2,700 acupuncturists and Chinese medicine practitioner. BC, there's around 2,000. Quebec, around 1,000 something. Across Canada, as I said, in the job bank, there's around 60,000 practitioners are caring for Canadians.
So 60,000 across this country depend on natural health products to be able to conduct their business and care for Canadians. So what is the economics? What is the economic impact of this business in Canada?
I don't have the exact amount, how much the economic impact, but 60,000, that's not including the farmers. That in Chinese medicine, we really emphasize on eating where you live. So a lot of us purchase products locally. You know, you have to eat where you. So Canadian farmers will be affected. Ginseng farmers, herbal farmers. These are all people that are directly or indirectly affected in Canada.
Do you believe that the policies that have been put forward by this Liberal government will have an impact on the day-to-day operation of these practitioners and these farmers?
Oh, yes, definitely. So what will happen is, so when they come in to see a consultation when I prescribe these herbs, they're going to see, okay, it used to cost $5 or $7 or $10. Now it's going to cost $50, $100 for a bottle that would last you maybe two weeks. So now it's a financial burden. Also, the Vanessa's law, it's Vanessa law is based on a pharmaceutical model. So it's based on a high risk product, not with a low like prescription drugs. So these risk profile is very important. So when you're doing a product profiling, it's not your pepper. What we prescribe, pepper, ginseng, or onions are not the same as warfarin or nicotine or these kind of products. It's not the same.
Thank you. Thank you. That's your time. Next, Ms. Sidhu, please, for 5 minutes.
Thank you, Mr. Chair. Thank you, all the witnesses being with us. Ms. Hoffman, most of us use natural health product regularly, but we know that the NHP are generally safer than other health products, yet they are not without risk. We heard 700 cases. They are a lot. What are the most common safety concerns your organization has been seeing?
Thank you for the opportunity to speak around the fact that NHPs are low risk, but there is some risk there. And certainly I'll start and then I'll ask my colleague to finish up. One of the biggest risks is around the dose or the amount of an NHP. And in some cases, taking a large amount or taking the dose that's ordered too often can create a significant risk. And we have seen that in previous cases. Other examples?
Other examples would be the person providing their own care or seeking their own care is not aware of potential interactions with other products they're taking. They can be pharmaceutical or other NHPs. They're also not well aware of contraindications. If they have liver, heart, kidney, eye disease, maybe this is not the right product for them and they don't know. Those then are preventable harms, because had they known, they wouldn't have used that NHP. And so warnings, not having clear warning on the package, having difficulty finding that warning until they get home or until after they've taken the medication and realized, oh, if I'd known about that warning, I actually wouldn't have used this product. I would have chosen a different product for my care or my family's care.
Thank you. We also heard from Ms. Hoffman. You said that Health Canada, if this bill passed, Health Canada would no longer to order label change if the serious adverse or something. Can you elaborate on that?
This falls under the Vanessa's law provisions, and there were 4 examples we gave, and one of them was that the bill would result in Health Canada no longer having the authority to compel, that's the important thing, to compel a label change if there's an identified serious risk.
Thank you. And Ms. Collard, in a brief to this committee, your organization pointed out tobacco as an example of a natural product that is also harmful. The lesson from tobacco your group wrote is that health authorities need the power to prevent harm. Could you expand on how the lessons from tobacco apply to dealing with the NHPs today?
Thank you. Well, I think it's probably used as the most historic example where people would say if we had only known how dangerous it was, it would never have been allowed on the market. But things get on the market, and then only later do you find out how the nature of the danger sometimes might not be anything, or sometimes it might be significant. But some of the most dangerous products, or some of the products that cause the most harm, are in fact natural products. Opioids are natural products, morphine's a natural product, tobacco's a natural product, cannabis is a natural product. And we've chosen, generally speaking, to regulate these not as medicines, although they're used for medical purposes in many cases, right? So we do it. I think the reason we made that submission is that it's too often that people associate natural with benign. And we have this kind of, it's a natural health product, therefore it's benign. So the common understanding of natural is sometimes, there's some confusion. Well, this is naturally derived, therefore it's okay. If we're chemically or produced in a factory, then it's harmful. And so I think that's an education gap we have with the general public. And I think it's an education gap we sometimes have in terms of a regulatory construct as well. Maybe we need a different term, for some, and maybe the catch-all of natural health products is too big a basket. But anyway, thank you for drawing on that point.
And you also said business model is a risky for marketing. So I just want you to explain that the business model, public health is an important analysis. Like what kind of the analysis do you think you should do?
Well, if you think of a company that's based on consumer health, they have a reputation to maintain that their products are safe and reliable. But if you have a company, an alcohol company or tobacco company, or someone that's already not dealing or not worried about its public reputation, it's worried about its return to stockholders, their activities will be aimed at maximizing sales, maximizing profits, maximizing use, so that the NHP, in fact, the Food and Drug Act was really designed with a certain kind of manufacturer in mind, and the Tobacco Act and the alcohol kind of falls in it, but the Cannabis Act were designed with a very different understanding that there's a different motivation to those manufacturing.
And
Thank you, Ms. Callard. Thank you, Ms. Sidou. Suite, Mr. Thériault, pour 2 minutes et 10 minutes, s'il vous plaît.
Bon, j'écoute votre témoignage, Madame Hyland, et j'ai l'impression que sans la loi Vanessa, point de salut. Et pourtant,
I believe that without the Vanessa's law, it seems that Section 16 allows Health Canada with the NHP regulation to ask a firm to change its labelling or to add extra warnings if the minister has reasonable reasons to believe that an NHP is no longer safe when it's used under these recommended usage conditions. So there's two scenarios. If the labelling is not in compliance, Health Canada can take enforcement measures and exercise powers such as seizure and holding these, as well as stop sale, suspending the licence also of the product. And if the label is in compliance but Health Canada wants to change it for reasons of health, Health Canada can require that the firm carries out the change to abandon the product. And if the firm is not in compliance, then there can be a stop sale order or suspend the licence for this product. So the industry already has a framework around it. We're listening to you, and it seems today that there's as if there's no regulatory framework, but I think we have to be rigorous in our approach. You are familiar, I imagine, with Vanessa's law for the pharmaceutical model, but it seems that you are not very familiar with the NHP regulation and how it is already enforced.
We can speak to our position today on B368 and be clear that our understanding is what we can speak to, that if the bill does go through, that the important, very focused provisions under Vanessa's law will be reversed. And one of them is to compel. So wording is very important with all these legislative mechanisms, and in this case, we understand and believe, and that's our position, that would be lost, a compelling provision around labeling. So although there is a regulatory framework, these regulatory provisions under Vanessa's law are at risk.
oui, mais
Yes, but when we listen to you speaking, it seems as if people today are not protected and that the industry can do anything it fancies. But in fact, Health Canada already has powers that are recognised in the regulation. We're going to add a right of recall for the minister, and I imagine that will then ease your concerns. Brief answer, please.
We understand that it's okay if I'm in English. We understand that there are regulations that are for NHPs, and they're different than pharmaceutical medications and designed different, and we support that. And also that Vanessa's law brought in new tools and new authorities that would benefit NHPs. One of them is the reporting of serious adverse reactions, and the other is a label change that maybe you don't need a recall then. And I agree that many recalls are voluntary and many label changes are voluntary, but it's not always the case. And imagine that Health Canada can't say, we've learned about this and this needs to be added to the label. Or,
Thank you, Ms. Hyland.
Yeah.
Thank you.
donc vous allez être satisfaite avec le droit de rappel.
So you're going to be satisfied with the right of recall, adds Mr. Thériault.
Important to stress for the record that of 350 cases, 347 were voluntary recalls. 3 were companies that were non-compliant with the voluntary recall and essentially are no longer in business. I think it's important for the record to state that. I want to come back to you, Ms. Keller. The 2 things that you said in your testimony that I thought were very interesting. First, the similar products in the United States have the label FTA not approved. In Canada, they seem to be approved by Health Canada, and the Zonic example is one of them. Is there anything we can learn from the U.S. example? And secondly, you talked about an integrated nicotine framework, which is something clearly, as we go through the witness testimony, as something that is clearly lacking. What do you think that would look like at the national level?
I think it would be shifting of the responsibility for dealing with, it would be an expansion of tobacco, vaping, and all other nicotine products. And it would be integrating the protecting public health from inducements to use products to non-users and the regulating them as cessation or harm reduction products at the same time, so that there's a consistency in how it's dealt with. So it would essentially be a way of regulating the industry as opposed to regulating the product. And I think fundamentally, it could look very much the same as it is now, a similar approach to regulation. We also need to modernize our regulations. The precision regulation approach, to me, is as someone who's, used to the fact it takes years and months to get a new idea across, the idea of being able to move swiftly with interim regulations or precision regulations, I think is very important. I don't have time to go into all the things, but the fundamental change would be to bring all aspects of nicotine into one regulatory basket, responsible to the same decision makers.
Coming back to my first question around the U.S.
Oh, well, it's interesting. Zonic products are sold as Velo products in other parts of the world by British American Tobacco, and they're sold as a recreational nicotine product, and they're sold to youth, and they're advertised on Formula One racing cars, and they're advertised on social media, and they receive very much the same kind of heavy promotion that cigarettes did in the last century. The only reason that they're sold as smoking cessation products in Canada is because that was the only route to market available to the company. British American Tobacco could not sell them legally in Canada unless they could convince Health Canada that they should be approved as an NHP. This happened actually not under the current health minister, but under the previous one. And when we asked the department, why did you let this go through? It was explained to us that the whole process of approval is very depoliticized. There's very little potential for the minister to intervene. These are scientific assessments done by a board that looks only at the evidence. Now, I'm not speaking for truth with this. It's not my area. I'm just reporting this is hearsay. But that it was not one where those other policies, things came in. It's just a very discrete kind of checklist. Does this meet this test, et cetera?
Okay, thank you. Next, Mr. Moore, please, for 5 minutes.
Thank you, Mr. Chair. Mr. Chen, we had the Minister of Health here some time ago, and we were talking about the mobility of those that are small business owners, those that are in the natural health field. He seemed to minimize the impact of this legislation and not recognize the impact perhaps on the Canadian economy of, as you pointed out in your comments, Chinese medicine practitioners, 66,000, virtually all of which represent what we would call a small business in Canada. Can you speak a bit to how investment could flow out of our country and to other jurisdictions where there is even less regulation and less safety should this bill not pass?
Yes, as I mentioned, if this bill doesn't pass, that means higher economic costs, harder for us to apply for NHP licenses. So a couple of us importers we already talked about, and these are all moms and pop shops that are importing these herbs. We're going to have to go south, and we're going to have to sell on eBay and Amazon, and it's not regulated. So there'll be more of us there'll be people. There's already people selling. If you go on Amazon right now, there are already Americans selling health products across the border. But because we are here, so it's easier for Canadian consumers to buy regulated NHPD regulated products that has labeling, that has a volunteer recall process. It's harder for them to buy online. But if we're not here, your only option is online. And that would, none of these regulations are in place. U.S. FDA requirement right now is just a nutrition label, and that's all we need. So nothing else. So it's cheaper, it's easier, and we don't need to go through the NHP. And remember, we're selling herbs here, so we could just not apply and not have any health claim. That's another option. That means even less regulation. Yeah, sorry.
Yes, thank you. We heard recently from a small business owner. He testified on Bill C-368. He said that if the legislation doesn't pass, Health Canada's new regulations on natural health products would cost his natural supplement business $500,000. What are your thoughts on the cost? You used the expression mom and pop, and that certainly characterizes many of these businesses. Certainly in my own riding, these are small businesses that are serving our communities. So when I hear of a compliance cost in that at that level, it is certainly a cause for concern, especially hearing you say about the ability to move elsewhere and to conduct your business differently. So can you speak a bit to the cost aspect?
Yeah, so most of us, we keep around 1,000 licenses. We don't import 1,000 different type of products, but that's because there are different practitioners and they need different things. So when they ask for something, we would try to get it to them within the month or two. But we would have that license ready because it takes about 3 months to half a year to prepare that license. So most of us have a license ready to that. And that's where all the costs come from, is for us to be ready for required products that we might or might not use. That would drive up to 50,000. Having 1,000 licenses, you're looking at 100,000 just to upkeep for a license that you might or might not use.
Okay. As obviously, that would have a profound impact on a mom and pop type of small business. You mentioned in your brief the punitive regulations could have on the impact they could have on parts of the Canadian agricultural sector. I think that's something that we probably haven't heard enough about. So could you, you mentioned a bit in your opening as well, but could you expand a bit on that, the impact on the Canadian agricultural sector?
In Ontario, Ontario Ginseng Growers Association, they have registered 150 growers, all of which are used by Chinese medicine practitioners. Ginseng is mainly a Chinese medicine herb. That whole sector would be destroyed. In Saskatchewan, there's 30,000 acres of land on herbs, natural herbs that we use and prescribe. All of that would be destroyed because we cannot afford to buy them anymore, even if they're grown in Canada. That's just Saskatchewan. Other province, I don't have the exact numbers right now, but all the prairie province that are planting herbs that we're prescribing would all be gone, literally gone.
Okay, thank you.
Thank you, Mr. Chen. Next, Dr. Pelosi, please, for 5 minutes.
I'm a little perplexed by...
Sorry, Dr. Pelosi, just 1 second. Colleagues, we're going to suspend for about 3 minutes to make sure that Dr. Pelosi's sound quality is okay, and then we're going to go to him. Back to order and give the floor to Dr. Pelosi for the next 5 minutes.
Thank you. And I have to say, I'm a little perplexed by Mr. Julian's argument, which is that the industry is already virtually 100% compliant. There have only been 3 cases where there was a request for a voluntary recall, but the companies refused to do so. So is it, in his opinion, why do we need this law at all? Well, it would seem to me a rather dangerous way to govern, to say, well, most people are in compliance, so why do we need the law? Do we say that about speeding around schoolyards? You say, well, most people actually slow down around schoolyards. You don't have to have any kind of law to prevent people speeding around schoolyards. So, I would like to ask Ms. Hoffman specifically, this law is all about applying Vanessa's law to natural health products. That's it. It's removing that protection, which currently natural currently removing that protection for natural health products. So within Vanessa's law, there's a whole bunch of different things. I've heard that there's amendments being considered which would water it down, take away some of the protection of Vanessa's law. And I wonder, which of these can we do without? The requirement for hospitals to report adverse reactions. I think we need that one. The ability to recall, I think we need that one. The ability to apply higher, more severe forms of punishment, I think we need that one. The requirement to change labeling, if required, I think we need that one. The requirement that a company, natural health product producer, might be asked to do more research into their product. I think we might need that one. Is there anything in Vanessa's law that you think we could do without if we want to amend this?
Thank you very much for the question. I can speak very clearly to what we have shared today around Vanessa's law and our concerns. The issue around being able to recall, the issue around requiring or compelling a label change, the issue around compelling additional tests, and the issue around hospitals being required to report serious NHP adverse reactions. Those 4 I can speak very clearly to. Our position is that they should be maintained, and or the Health Canada should have the ability to bring forward the necessary regulations to enable those requirements.
Mr. Chen, thank you for coming in. I certainly appreciate the fact that a lot of the herbal medicines you use are herbs like ginseng and ginger and things that we use in our everyday lives. Why do we need to regulate these? However, you kind of spoke about the economic harms of this legislation. I'm again a little perplexed by that. This is about the application of Vanessa's laws to natural health products. There's nothing about cost recovery. There's nothing about the cost of a product license in here. I'm not sure exactly how you figure that this is going to cost companies a lot of money if in fact they're compliant. Yes, if you are fined by the ministry for violation, with Vanessa's laws, there'll be the possibility of increased punishments, but I don't see anything in this law which is going to affect the profits of most companies.
Thank you for your question. Yeah, so part of the change in the law, there was cost recovery. So it does cost money to apply for NHP. So that's where the numbers come from, and there actually are.
But sorry to interrupt, Mr. Chen, but I don't see anywhere in this law that talks anything about cost recovery.
In my slides, if you have a copy of it, there was a section with source. So in there's a link to direct you to Health Canada that has that, so you can refer to that. And Vanessa's law that you referred to refers to risk profile, as I had mentioned earlier. So when you look at risk profile of, and you're an MD yourself, so if you look at things like, clozapamine or any type of steroid drugs, and so these are not the same as ginger or honey. So, how much Vanessa's Law application do you want on your eggs? That's basically what you have to consider.
Thank you, Mr. Chen. Thank you, Dr. Pelosi. Next, we're going to go to Mr. Doherty for 5 minutes, please.
I'm going to see my floor or my time to talk, Alice.
Dr. Ellis for 5 minutes, please.
Thanks very much, Chair. Certainly we've talked a fair bit about difficulties with natural health products. This is a very serious topic that's come up many times. We've heard from Dr. Sharma previously when the original omnibus bill was presented, talking quite frankly very much out of order with respect to the death of a young child in Alberta, which realistically had nothing to do with natural health products. All of this talk about numbers and outcomes has really cast a very negative light on natural health products in Canada. And obviously that is a very serious allegation that once again, we've heard some egregious allegations from the minister, which he was not able to substantiate. And again, even today, sadly, we've heard from witness after witness who want to tell us that this data exists, but really, for some reason, have hesitancy to provide it. And therefore, Chair, I think this is important enough that I'd like to move a motion related to this particular set of data, that the Health Committee request a list of provide a list of the 700 incident adverse reactions, the date of the incident, the product involved, and the outcome, and this must be provided to the Standing Committee on Health within 30 days. Thank you.
I translated it.
Okay. Dr. Ellis, I believe the motion is in order, but I'm a little confused that you would actually ask for the Health Committee to make the production. I presume that the motion is directed to Ms. Hoffman and Ms. Hyland's organization, the Institute for Safe Medication Practices Canada. Is that right? You're asking to them to produce the documentation.
That's correct, Chair.
Okay.
You know what? I'll give you some background since you asked why I would ask and why I would move a motion to do that. As I said, this is a $13 billion industry. What we've heard over and over and over again is this egregious testimony that has been fueled by words that are very emotional in nature. We've had the minister here saying that this is a cuckoo bananas bill. First of all, what minister would talk like that? We've heard him also talk about factories full of feces and urine, and again, nobody was able to substantiate. We asked for this evidence before at one of our previous meetings as to tell us a bit about that. How many of these factories exist? And then, of course, the minister went on to talk about, well, how much feces and urine is acceptable. Again, without any substantiation, we've heard these claims over and over and over again. We've also heard other foolish claims to say that, well, this doesn't affect labeling. The change in the name of therapeutic product, a definition of a therapeutic product, is really what allows all of the other changes to happen. So yes, all of those things are part of this, which again, the minister went on and said that that's absolutely not true, which again is playing loosely with the truth. And I do believe that the only way to put this to rest is to require and compel, under the issue of parliamentary privilege, for these egregious claims to be justified. Because you know what? Are there 50, out of the 700, are there 698 claims where somebody read the label wrong and they were mad because they got the wrong product because they couldn't read a label? Well, this has nothing to do with that. That's unfortunately, that is someone who just refuses to read a label properly. So on behalf of this committee, I think it important that we finally lay this issue to rest. There's been many claims made. We need the documents. People would appear that they don't want to provide the information. Does it not exist? Or is it actually true? And to what level of difficulty have natural health products played in the lives of Canadians? And certainly, as I mentioned previously, from the stacks and stacks and stacks of cards and letters and emails that everybody here, and I know that is not just a Conservative issue, that my Liberal colleagues have also received untold correspondence, particularly with the original omnibus bill introduced by this NDP Liberal government. And now we're continuing to hear of these adverse events, and nobody will provide the information to say what it is. Realizing that they are different kettles of fish, so to speak, we also know that 13,000 seniors are hospitalized every year due to prescription drugs. Again, is that different? No, it's about context. It's about the context to say this is a fact. It's not that somebody took a wrong pill and they were upset about it. But what we're saying here is that 13,000 seniors are admitted to a hospital. That's the seriousness of the effect related to prescription drugs. So that being said, I think it's important that we compel people who put forward claims that they are required by Parliament to put these claims in writing, and I think that it behooves the committee to finally lay this issue to rest. So thank you.
Thank you, Dr. Ellis. The motion is in order. The debate is now on the motion. It would be extremely helpful if we had the text.
Translated to you now. It should be in the clerk's inbox.
Okay.
Oui, rappel au règlement.
Oui, Mr. Thériault.
Point of order, Mr. Thériault. I would like it to be read out again, and I'd like to have a French version that should be provided to the interpreters.
Merci, monsieur.
Thank you. We've just sent it to the clerk in the 2 languages, and they will be sending it by email right away.
Dr. Pawlowski, please.
Well, Stephen talks about egregious allegations, and that, again, the suggestion is that the vast majority of these drugs are safe, which is true. But we know that even drugs which are normally safe, taken in normal doses, can at higher doses be exceedingly dangerous. A great example of which is Tylenol. We all give Tylenol to our kids. We take it all the time. This is really safe. Well, as Stephen, like myself and Brendan know, people die of Tylenol overdoses. So there certainly is the possibility that with any drug in sufficient quantities can cause harm to people. So that's one thing. But specifically on the motion, I know that the people from, now I'm forgetting the exact name of the drug agency, monitoring group, but Ms. Hoffman, when the issue came up earlier about revealing your data, you had some privacy concerns. I know that the other person there sitting beside you had wanted to speak a little bit to this. As someone who myself, a bunch of us here are medical practitioners or were medical practitioners, we certainly understand privacy concerns. Could you tell us a little bit about the privacy concerns in revealing your data? Because I think that's really central on this issue.
Dr. Pawlowski, we got ourselves into a bit of trouble when we invited witnesses to participate in debate over a point of order or a motion. So I'm not sure that's appropriate unless it's the will of the committee to allow them to intervene in the debate on the motion. It appears that we don't have unanimous consent. That's for sure. So if you want to finish, you still have the floor. Yes.
Okay. Well, if I still have the floor, saying then absent being able to hear from them about their privacy concerns, then I don't support this motion. Obviously, medical records are confidential. If people have confidentially passed on information about what's happened to themselves, this isn't something which should be made public, and nor should we be asking them to make that public. So if the will of the committee is to not ask them about their privacy concerns, they've told us they have privacy concerns, and in my mind, that's enough for me to be against this motion. Thanks.
Thank you, Dr. Pawlowski. Mr. Doherty, please.
Thank you, Mr. Chair. And to Dr. Pawlowski's comments and the comments earlier on regarding privacy concerns, committees are oftentimes bound by confidentiality rules, no different than when we talk with our constituents. I'm not going to share unless given that approval from the constituent to be able to share the information that's given. All that would be necessary is if, whether it's these witnesses or any witness that appears before the committee and with concerns regarding confidentiality, can say and advise the committee that they will supply the information or table the information as requested by the committee or as bound by the committee, but obviously put the caveat in there that there's sensitive information and confidential information in there, and that the request is that it's not shared publicly unless specified otherwise. So that is a way that we can go. But I just want to talk about not necessarily these witnesses, because unfortunately they're the ones that are here today, and this issue is brought up. As mentioned earlier on, I will preface my comments. I've never smoked before in my life. I'm not a smoker. I'm not a shill for the tobacco companies. But I do think that there are mechanisms in place for the minister to deal with the issue at hand, irrespective of NHPs, and not really take it out on a $13 billion industry. However, we do have, and it's not just this committee, but other committees, we do have people that come and testify before the committee, and they state stats and numbers and facts and cases and what have you. And we haven't, to this point, oftentimes compelled these witnesses and a minister to back up their comments. We had the minister, as mentioned earlier on, say some egregious things towards the industry and feces and urine and what have you. And I almost think that there's a drinking game going on for the people that are listening in. Every time feces and urine is mentioned on this topic alone, somebody has to take a drink back home or drink around the table, what have you. But even gargling with gasoline and things like that, comments that are made that are inflammatory, that there's no basis for background, how to back it up. I think as this committee moves forward, not just this study, but other studies, we should compel our witnesses, again, not pointing fingers, but compel our witnesses to if they're going to state things such as that, or have that information in advance or at the time to back up their testimony. And we haven't done that, and I think we have to be more astute and more on the ball with that. I think this, I compel our colleagues across the way who Dr. Pawlowski says he's not going to support this motion. All we're asking for, and it's not just this study, but is for this committee to adopt the policy that when we have witnesses that they and that are entering testimony that has industry-specific or topical stats and figures, that they have that information at hand that you can back it up. Because anybody can go and say, listen, there's 700, we'll use that as an example, there's 700 cases of claims of people misusing the information or the medication or the products. We had Dr. Sharma here, well-respected, a physician, somebody who is at the top of her profession, and one that government takes direction from. I'm going to err on the side of her. I believe she misspoke. She didn't intentionally
intend to mislead us, say that, that 18-month-old child was died from natural health products. And we know that that wasn't the case. And so it's things like that, it's cases like that we have to be, as a committee, and as people who are developing policy, who influence policy, we have to have all the facts. Ms. Keller mentioned that bureaucrats move at a glacial speed in changing legislation. So making sure we have the right information at the right time to make the right decision, and that can influence the decisions, and not just some knee-jerk reaction or comment that you can't back up. What else have we heard? Gargling with gasoline and again, drink urine and feces filled factories. Look, I don't want to be, and I'm in need of natural health products right now for my knees. That's why I'm standing. So if anybody's listening, no, I'm just kidding. But I want to make sure that we're on record as saying, because we get all heated here, on record as saying, look, we don't want any Canadian to take a product that is could be detrimental to their health. Nobody's saying that. What we're saying is that there are tools and mechanisms in place. We have to understand that the information that's being presented, whether it's by these witnesses or others or even a minister, that it is backed up with fact and information that can provide or prove that that information is fact. That's all we're asking. And this is a simple motion that I think can help clear up some issues that we are going to have in the future. Thanks.
Dr. Ellis, please.
Thanks very much, Chair. I think it's very important to know. To me, it would appear that the NDP Liberal government wants to kill a fly with a sledgehammer. And the question then remains, what does the data actually tell us? We've heard this number of 700 thrown around. We actually, oddly enough, when we asked this from the Health Canada officials last time, they said you can find it yourself on their website, which, quite frankly, is impossible. It's not possible. We tried to do that. And that is also why industry asked a very well-respected company, Deloitte, to do a deep dive into the potential adverse events associated with natural health products. And I can tell you for certain that they would be happy to table that at committee. And secondly, that they were nowhere near this insane number of 700. And again, I think I'm a bit disheartened by my colleague, Dr. Pawlowski, to say that he's not interested in supporting the motion. He's been a very data-driven guy. What's there to hide from? If we ask for data, and 698 of the 700 supposed cases are all about somebody misreading a label, well, that's very different from 698 cases of liver toxicity, which Dr. Hanley mentioned, not 698 cases, but he mentioned cases of liver toxicity. As did witnesses here from sick kids who said they knew kids had been harmed. We asked, okay, well, which kids? How many kids? What was the harm? What was the substance? And once again, no answer. And my colleagues across the floor, attempting to say that we're being mean to witnesses. Well, you can't come to committee, not be prepared, and make egregious claims and not provide the data. That's what we're here to do. We're here to make decisions and understand the actual metrics that if they exist, that should be a part of the knowing. So with the context, with the actual data, that will allow this committee to make better decisions. So if there are claims out there, show us what they are, provide the data, provide the substance, provide the date, provide the outcome. That is not a difficult ask. Thank you.
Thank you, Dr. Ellis. Dr. Pawlowski, please.
Well, a couple of things. With respect to Stephen's difficulty accessing data from Health Canada, I would suggest to our ministry colleagues to help Dr. Ellis find his way through, and I know you go to a lot of web pages, finding your way through the various pathways can be difficult. I would ask them to help Dr. Ellis out in navigating their way through this, number one. Number two, I too would like the witnesses to, within the confines of their privacy concerns, if they could forward to us what data that they are able to, given those concerns, I think that would be very useful to the committee. Now, having said all that, I'm going to roll the dice and ask that we adjourn debate.
A motion to adjourn debate is not in itself debatable. We'll go directly to a vote. Show of hands, please. All those in favor, all those who wish
Chair,
that the
I'd like
debate...
to request a recorded division, please.
A recorded division on the question of whether the debate on this motion should now be adjourned. Madam Clerk, please.
Mr. Henley.
Sorry, the question is on adjourning debate, not on the motion?
Correct.
Okay.
To adjourn debate on this
Okay,
motion.
I support.
Mrs. Hefner.
En faveur.
Mr. Nakvi.
Yes.
Mr. Polowski.
Yes.
Mrs. Sidhu. Mr. Doherty.
No. No.
Mr. Ellis.
No.
Ms. Goodrich.
No.
Mr. Moore.
No.
Monsieur Thériault.
No.
Mr. Julian. Yeas 6, nays 5.
Debate on the motion is therefore adjourned. Dr. Ellis still has 4 minutes left in his turn.
Point of order, Chair, or maybe it's perhaps not, but I'm going to ask it anyway. The next steps in this committee are to have a clause by clause in this bill. How would this motion ever be returned to debate? Be possible to return then?
A motion to resume debate on this motion at the next meeting would be in order.
Thanks very much, Chair. So when we begin to look at the difficulties with this bill, I guess I'll ask some very pointed questions. Ms. Callard, would your organization be open to an amendment removing nicotine-containing products from Bill 368?
That would meet many of our concerns, yes.
Thank you very much. Ms. Hoffman, same question. Would your organization be open to removing nicotine products from Bill 368?
Today, we speak on the concerns that we have with Bill 368 and a number of concerns, and so we are silent on any proposed amendments today.
Sorry, I guess I don't understand that. You spoke very strongly about nicotine-containing products and how this bill would cause difficulties with that, but a specific amendment removing nicotine-containing products from this bill, you have no opinion on that?
Speaking in isolation about one amendment without the ability to consider what the legislation would look like, we're not in a position to speak for or against today. But we'd be happy to consult
Thanks
in
very
the
much,
future.
Ms. Hoffman. Can you tell us, has your organization received funding from the Government of Canada in the past?
The ISMP Canada does receive funding from the federal government, but also provincial governments, healthcare organizations.
And how much money does ISMP receive from the federal government on a yearly basis?
We have a contribution agreement with Health Canada, $1.8 million per year.
Thank you.
Approximately.
And Ms. Dukas, would your organization be opening to an amendment to Bill 368 removing nicotine-containing products?
Thank you for that, Dr. Ellis. The devil's in the detail, but on principle, yes.
Thanks very much for that. Mr. Chen, if I could turn to you, you know, what we've heard, you've been in, and I know that your family has been in the traditional Chinese medicine space for quite some time, helping many Canadians with respect to their health issues. Could you tell us a bit about how serious you take the importation of traditional Chinese medicines on behalf of Canadians, and have you ever had your products contaminated with rodent droppings and urine?
Yeah, that's never happened. All the factories that we use has ISO regulation. It has GMP regulations on top of everything. So we follow very strictly to what's required in good manufacturing practices. We also have in every batch that we require heavy metal testing, pesticide testing, microbial testing. So that's for my company. I think most companies, when we apply for NHP, it's required that we submit these information. So existing regulations require us, and that's why Canadian existing MPN regulations are envy. And when people ask me, I actually referred a couple of manufacturers to come to Canada to apply for NPN, and we actually export Canadian licensed products to other countries because they envy the regulations that we had, without making it difficult for us to become. Right?
So, Mr. Chen, suffice it to say that your company and anybody else you know inside the NHP industry takes very seriously the quality of the product that you bring here for Canadian consumers.
Yes, I use the product myself, so it's important that we guarantee, well, we can't say guarantee, but we ensure that the Canadian public is safe from our product, and that's why we could sell it as food product, but we want to do better, and that's what everyone in this industry is trying to do, is that we could sell it as food with just a food license, but we want to do better, and that's why we apply for NHP licenses. By destroying that, you're destroying what we're trying to achieve to become better Canadians.
Thank you, Dr. Ellis. Thank you, Mr. Chen. Mr. Nakvi, please, for 5 minutes.
Thank you very much, Chair. Chair, at this moment, I would like to resume debate on the motion that I had tabled.
Point of order.
On the supplementary estimates.
Okay, we have a point of order. Just before we go to the point of order, a motion to resume debate is a dilatory motion that is not subject to debate, so I'll hear the point of order. And then the normal course of things would be to go straight to a vote on the motion to resume debate. Ms. Goodridge on a point of order.
Unless something is vastly different than what I'm aware, I don't believe you can resume debate in the same meeting that a debate was adjourned. Could we ask for clarification from the clerks?
Thank you, Ms. Goodridge. This is a matter of which I was not aware, but you are correct. Absent unanimous consent to the committee, a motion to resume debate on a motion that was presented in the same meeting is not in order. Do we have unanimous consent to go to a vote on a motion to resume debate? We do not. Back to you, Mr. Nakvi. The motion is not in order. You have the floor.
Okay, Chair, thank you. Then I will put forward a motion that upon the tabling of supplementary estimates B for the fiscal year 2024-25, the committee invite the Minister of Health and the Minister
Point of order.
of Health and Addictions to testify on the supplementary estimates B at the first meeting following
point of order.
the passage of this motion.
Mr. Nakvi, excuse me, we have a point of order from Ms. Goodridge.
Thank you, Mr. Chair. You can't do indirectly what you can't do directly, and you cannot put forward a motion that is on the same subject as a motion that has previously been adjourned, and therefore this is out of order.
Thank you very much, Ms. Goodridge. If you could let Mr. Nakvi complete his thought. I expect that you might get a ruling that is almost the same as what you just said. Go ahead, Mr. Nakvi.
Speaker, this is a very important motion that needs to be. I think it's appropriate for it to be debated. I think if once we have an appropriate debate on this motion. There may be opportunities to amend this motion from other members as well that I'm open to hearing. But I think it's absolutely necessary given the kind of antics that we are seeing in the chamber at House of Commons by the Conservatives, where they have
Point of order.
basically been.
We have another point of order from Ms. Goodrich.
Thank you, Mr. Chair. This member, the member from Ottawa Centre, is a lawyer and was actually the Justice Minister in Ontario, and therefore should understand parliamentary process and procedure. And what he is trying to do is against the orders of the House, as I have pointed out, and he is trying to do indirectly what he cannot do directly, and I believe that this is absolutely shameful. He is trying to do this for political gain, and this cannot go forward.
Mr. Naqvi, the motion that you propose to present, is it the exact same motion as was presented earlier in the meeting, or is it a different motion?
Speaker, I can present a different motion.
No,
so I will present a motion.
That's part of the problem.
Yeah.
Mr. Chair, but this is part of the challenge.
Ms. Goodrich, please. Mr. Naqvi has the floor. I've asked him a question. If you propose to introduce a different motion, you haven't given notice. So a new motion would be out of order. The same motion would be out of order. A motion to resume debate would be out of order.
Well, that's why, Speaker, Chair, I was asking for this motion to be debated so that we can make any appropriate amendments, as usually the course in this committee at all times. Of course, the Conservatives do not want to talk about this motion, as they love to filibuster at all times, as we're seeing they're filibustering the House at this moment, because they do not want to hear from the ministers.
Point of order, Mr. Chair.
We have a point of order from Mr. Doherty.
Mr. Chair, I'm going to ask that you rule our colleague out of order.
I just did.
I agree you have, but he's clearly not listening. So I think his mic should be shut off, and I think we can move on to or adjourn debate. Adjourn the meeting. Sorry, thank you. I move to adjourn the meeting. Is what? How's that?
You can't move a motion on a point of order.
Okay.
Mr. Naqvi, back to you.
Well, Speaker, Chair, as I understand that. One can move a motion on the same subject, and that is what I'm attempting to do while continuously being obstructed by the Conservative members, as they are quite comfortable to filibuster this committee and other committees at all times, as they are doing so in the House of Commons at the moment.
Point of order.
Do not want to engage.
Mr. Naqvi, we have a point of order from Ms. Goodrich.
Thank you, Mr. Chair. You've ruled Mr. Naqvi out of order, and therefore him continuing is challenging the chair. So is Mr. Naqvi attempting to challenge the chair? Because if so, I believe that is a vote that has to go forward.
Mr. Naqvi has 5 minutes that he can use to offer comments or questions to the witnesses, and he's approaching the end of those 5 minutes. But until he does, he has the floor. Go ahead, Mr. Naqvi.
Well, thank you very much, Chair. I think it is, I'm sure the Conservatives, when they are on the receiving end of hearing the kind of tactics that they continue to deploy by ensuring that not appropriate debate that's in the best interest of Canadians takes place, they resort to these procedural tactics. I think it is extremely important that this committee hear from the two respective ministers on the supplementary.
Thank you. Thank you.
Estimates.
Thank you, Mr. Naqvi. I'm sorry, but that's your time. We are past the appointed hours. At the will of the committee to adjourn the meeting. Yes. We're adjourned.
Thank you.